Hey everyone, welcome to today's episode. I'm really excited to be joined by James Griffin, who is the CEO and founder of Invene. I won't steal James' thunder here, but James has built a really successful AI consulting practice focused on healthcare. James, let me just take a few minutes here, and if you could introduce yourself, tell us a little about your company, your business, and your focus.
Yeah, so as mentioned, I'm James Griffin. I'm the CEO of Invene. I've ran this company 7 years ago for 7 years. And basically, right now, what we do is we help mid-market and enterprise healthcare companies strategize, build, and implement whole new AI products. So we come in, we actually look at their existing tech stack, and then we figure out where they should be putting their investments and where they should not be not. Because in our belief, actually, is that a lot of companies are spending tens of millions of dollars on AI and then they're just lighting it on file because A, they shouldn't be investing in it because it's going to be highly commoditized, or B, they don't have the data to actually make it a reality. So we actually help our customers go solve that. And then how we kind of did it was that we used to be a pure engineering firm a long time ago, but then recently we acquired a company called Idea, which was a top strategy and product design firm. So we could be a full stack product engineering firm beginning to end for all of our clients in the payer, provider, life science, and med device space.
Cool. So like for example, what would your ideal customer profile be, and what are the types of projects that you would do for them?
Yeah, so my ideal customer profile, when I started out, it was startups. It feels
Yeah,
like that's whenever someone started out, but
yeah.
over time it kind of became the mid-market PE-backed healthcare companies that acquired 8 to 9 different companies. They're stitching it all together, and now they're trying to rapidly scale so they can sell to a strategic or another PE buyer. And then over time, we've also added enterprise buyers, so those companies that are 5 billion and up that are publicly traded companies that really need to build their competitive moat. So those are kind of our two segments: PE backed, mid market, and then enterprise.
So these are actual software companies, and you're working with the software company?
Hit or miss.
Yeah.
So, for example, sometimes we'll be working with the big payers. So some of our past clients are like Cigna, Express Scripts, those kind of players, or it may be providers or the med device companies themselves. And then yes, we have a very, very much large segment of health tech companies that are selling into the payers and providers. It really
Awesome.
just depends. We kind of see everything across healthcare.
Gotcha, gotcha. And so what attracts healthcare executives to your door? Like, what are the common AI challenges that they're facing? What are the types of questions and problems that they come to you hoping to solve?
The reason why they come to my door is because they understand that the problem with traditional firms is that they try to do too much, where they try to be everything to everyone, while we, since our founding, have been very, very healthcare specific.
Yeah.
Generally, what people are coming to us about is around how to best utilize Gen AI and help increase the reliability of it. Because the problem people are finding is that they can get a model to, let's say, 92% accuracy, but it's much harder to go from 92 to 94, same hard to go from 94 to 95,
Right.
95 to 95.5. So there's like scales of difficulty, and not only building the engineering to scale, but also figuring out how you're going to build the user experience and the design to actually get the desired output. Because the problem is traditionally when we built software engineering systems, it was deterministic. Everything had 100% accuracy. Now we're in the non-determinism age.
Right, right.
So it's trying to figure all that out.
Cool, cool. And so, how do you help your clients then identify and evaluate their AI options? Maybe if you could, help walk us through the process of how you do that.
Yeah, so usually it starts out, we help for select clients, give them kind of an AI product roadmap. It's kind of we look at there's about 14 different places in AI that we have seen where they can make investments, and it's really dividing them up into L1, L2, L3, and it's different levels per investment. And the thing is that we usually tell people don't even try to touch level one, tons and tons of players in it, and it's not differentiated, it's not commoditized. But when you get down deeper levels, that's where you can really build real competitive advantage.
Interesting.
So that's kind of our vision, our approach.
Cool, cool. So you had mentioned in a previous conversation that you had a bold vision to disrupt the traditional management consulting business, especially the Big Four. So what's broken about the Big Four, and how is your approach different?
So when you think about why the big four do great right now, fundamentally what they do is they achieve it via access, not always necessary results. Look, they have brilliant people, but at the end of the day, what's been traditional is that they just had the access, but over time, people are looking for more effective vendors. They're looking for results, and it's much change versus, hey, are you hanging out at the country club to, hey, can you actually deliver me the result? That's number one. Number two is that the business model is fundamentally flawed, where let's say maybe not big four, but I talk about sometimes with some of these large offshore engineering
Yeah,
firms, let's say a
yeah,
Tata or Wipro, Unisys, all these guys, their business model is around heads, but with LLMs and how well they code, it makes it so you get much more leverage per engineer.
yeah.
So their business model has to fundamentally change when, let's say that you get an engineer that's 10x more productive. What happens in your business model where it's based on volume? And
Right.
so they will survive because they're big, they're large, they have great presence, they have great executives, but what they sell in the future is going to fundamentally change.
So AI has really been sort of a real turning point for you, right? I mean, it gives you the power now to do things that even a few years ago probably would have been very difficult to do.
Yes, because I've been working on AI personally since 2017, 2016.
Yeah.
But even then, just the level of work you can do, I look at it this way. So it used to be programming was a very, very hard skill to actually go do.
Yeah.
It's very coveted. And now you can talk to anyone off the street and they'll be like, oh, yeah, I just had an LM throw together a Python script. Do they understand it? No, but it runs.
Right,
So
right.
it's been a very interesting around the, let's call it democratization of knowledge, because consulting usually sold knowledge. Now, knowledge, you can get it almost at any time. Now,
Yeah.
what you're selling is discernment. I have all these options. Which option should I choose?
Right, 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 right. So many of your clients are PE-backed healthcare companies that are transitioning from multi-point solutions to integrated platforms. Walk us through this transformation and what are the common pitfalls and how does the AI strategy fit into this evolution?
So, one of the things that we've noticed most common is they try to cut corners where they're like, okay, we're going to integrate everything. So marketing and sales start selling an integrated solution when they haven't done any of the technology integration. So you get all these sales and you get these upsells and then you're increasing your EBITDA and it's really exciting. Then a year or two later, you're getting all these complaints from your current customers that nothing connects together. And hey, why isn't one common platform? So they kind of have bad sequencing because yes, you need to get sales and marketing, you need to get excited, but you have to do all the hard, heavy lifting, data engineering work, make sure all the integrations are set up along each other. And so I really think it's around, okay, are you standardizing the front ends? That's always a good thing to give a same look and feel. And then the back end, do you have all your different data flows? You probably shouldn't go re-architect the whole data flows. A lot of times it doesn't make sense to actually go rebuild in different systems, but do they have API integration layers between each other? That way they can flow beginning to end. And this is very important that you need an enterprise data warehouse so you can actually like service your platform level data because what you probably did when you bought all your companies, now you have 9 different data suites.
Right,
You
right.
have to consolidate all of them to actually get any useful insights because that's the benefit of platforms. If you never integrate them technology wise, you might as well just kept all those business units separate.
Gotcha. 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 So, obviously, agentic AI is a popular topic now. What are you seeing in the healthcare space around agentic AI? Is it ready for agentic AI? Give us some insight.
That's a really good question. Is it ready? I mean, it's coming, whether or not they're
Yeah.
ready. So that'd be the push pull there. I think that it is, especially for administrative burden, because as you know, there is just so much extra work that providers are doing right now. These health systems are losing money, and so everyone's talking about administrative burden, both on the providers and in the back office staff. And I am seeing a lot of things, let's say in the RCM space, in the medical assistant space,
Yeah.
just like every single vector, I am noticing it. The problem is that it's like we're at the beginning eras of it, where it's exciting. We're in the World Wide Web, it's happening, and like they work in, let's say they make a really sexy demo.
Yeah.
It's much harder to actually get these live in production and get them to actually give results that you need on top of all the change management that happens because it's a fundamentally different process. Let's say your agent is 94% accurate and then you
Yeah.
get the 6% non-accurate, you flag them in an audit log, or there's all sorts of mechanisms that you do it. The problem is that it's a fundamentally different way of working and it's all about, change management. And the problem is sometimes as technologists, you just jump ahead and you're like, hey, let's go implement this technology. And then you never bring people along in the change management
Right,
process.
right, right. And I guess from like a customer perspective, right, a consumer perspective, again, when you're dealing with, especially in the world of healthcare, and you've maybe have, you've got a problem, right, and you want that problem solved, it tends to be quite stressful. And I suppose, if you get sort of the wrong advice from an agent, then that can potentially create some problems, right?
Well, yes. And the other problem is like, for example, malpractice.
Yep.
Okay. That's why a lot of people are voting clinical agents. But let's say that you have decision support system, you recommend something wrong, and then the doctor does it. Ultimately, at the end of the day, the provider is going to get sued,
Right.
not the agent, because you're going to indemnify it. So that also causes a problem that has held a lot of things back. Also, is that ultimately who's responsible at the end?
Right. 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 So what about from a regulatory perspective, James? So the work that you do in AI and healthcare, what are some of the common maybe regulatory questions that you get, and how do you deal with them?
So what we found end up happening right now is large enterprises are adding a lot of clauses around no AI in their contracts. And it can even happen, let's say you're selling an AI solution, they'll still sneak that into your top level clause or your MSA anyway. And so there's a lot of confusion, especially on legal and business and and technology stakeholders around what AI is and understanding, hey, Gen AI is a subset of it. What is actually fine tuning? So really what I most of my questions get around is like, okay, they're simple questions around, hey, can OpenAI train on this data? Or hey, can Claude do it? Or can Google do it? Understanding proprietary models versus open source models. The other thing I'm asked around a lot around is, okay, is this HIPAA compliant? HIPAA compliance isn't that hard. You just kind of get the BAA chaining in place. But at the end of the day, I usually find it's a technical literacy issue, more so when you're dealing with legality and understanding what each piece mean, because right now a lot of well-meaning lawyers to protect their companies are adding in these overarching clauses in
Right.
their
Right.
contracts, but it's not, it may be actually holding them back. So there's a lot of education that has to happen in the space.
Interesting. Interesting. Hey, this has been just a really fabulous interview so far, James. Just one final question here as we wrap up. Maybe what are the two or three most important lessons that you'd share with healthcare and life science executives as they try to kind of incorporate and navigate their AI strategy?
Number one is that LLMs are fantastic about taking unstructured text to structured text. So whenever you're doing an evaluation of it, of like what AI is really, really easy to do, think about that. It's like ambient clinical listening. We help build one of the providers in the space. And that what happens is basically, okay, you take all this unstructured corpus of data from the EMR and you translate it into a clinical SOAP note. That's unstructured to structured. And that's what LMs are great at. So when you're looking at investment, those are really, really easy. However, getting a high accuracy is what causes a lot of your development time. Anything that's still traditional AI will cost you a lot of money, but if it's simple, unstructured to structured, writing emails, clinical summation, that's going to be easy. Those are quick wins. Number two, it's about building AI momentum. You need to have wins across your organization that show real ROI. I know companies that have spent tens of millions of dollars on research and development and got, let's say, 25 cents on the dollar for it. You need to be showing that you're getting real measurable improvements. Either you're increasing your operating margin or you're increasing your revenue from AI so you can build momentum for further and further investments. Third thing, you need to have a really good. So we build a lot of custom AI products, but I say this with love. Building custom software is like adopting a puppy. And so you got to be careful around what you're actually investing your resources on, what you're building custom versus what you buy off the shelf, because you have to have a very good understanding of your data moat and your competitive advantage, because it is always going to be cheaper to buy than it is to build. And so you need to make sure they have a really, really good understanding, and that you need to sometimes push back on your technical team when they want to go build all these new shiny things. Be like, should we, or should we just go buy the leading provider here because that isn't our competitive advantage? Those
Right.
are kind of my three top tips I give to healthcare executives.
Cool. Cool. Well, James, this has been a great interview. Thanks so much. Congratulations on your success and all the best going forward.
Appreciate it.